Hi, I'm Colleen Hutchinson. I'm here with Phil Schauer, Director of the Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. Phil, thanks for being with us. How about we just start with you telling me a little bit about some changes over the years in the meeting?
Thanks, Colleen. MIST has been a labor of love for me for 17 years now. The history of this is we started this, primarily in ski venues, and that was a lot of fun, and there was a lot of interest in doing that. And over the last 4 or 5 years, Vegas has kind of become our new home for a variety of reasons. I think for surgeons, it's a pretty easy place to get to.
Yeah.
It's fairly inexpensive. There's a lot to do in Vegas, and Vegas has kind of become one of the key, medical education destination places in the country. So, and the audience, likes it. We've grown very nicely, double-digit growth the past several years.
That's fantastic. What would you say, what's new here this year at MIST?
Oh gosh, there's so much going on in so many different areas. We always kind of highlight these kind of key areas of MIS: colon, hernia, foregut, bariatrics. We added a new section this year, enhanced recovery.
Yeah.
The ERAS, which is a really hot thing that is important to all surgeons. And this is the ability to get your patients out of the hospital sooner, so they get back to work, quicker, reduce postoperative pain, suffering, and recovering, and reduce the cost. So there's a lot of economic forces and, of course, patient satisfaction that are driving this. So it's really exploding. So we had a full session on that. We also had a workshop devoted to one ERAS technique, that is tap block. It was very popular. This is a way to block the abdominal wall to reduce postoperative pain, and especially narcotic use. And so we're definitely going to bring that back next year.
Great. What are some key presentations or highlights coming out of this year's symposium that you'd like to share?
Yeah, wow. So in the colorectal, for example, in that robot, a lot of talks on that. It seems to be taking a hold. It's still controversial.
Yes.
There's some surgeons that don't think it really adds a whole lot and it costs more. On the other hand, there's some areas, particularly in the pelvic area, that more difficult rectal procedures where it seems to be gaining a foothold there.
Yeah.
So that's one area. And with respect to hernia, more and more very challenging big abdominal wall hernias are presenting, and all kinds of controversy there about which type of mesh to use,
Yeah.
Synthetic versus biologic, or some of these advanced flaps. So it requires quite a bit of expertise, and so a lot of coverage there.
Yeah.
Foregut was really, really neat because the new anti-reflux
Yeah.
procedures, there's a variety of now. It's almost confusing. In addition to the gold standard Nissen fundoplication, there's the magnetic sphincter enhancing device, the LINX device. There's the endoscopic plication devices that create kind of an internal Nissen. There's also the Stretta procedure. So a lot of discussion about how these can be used and what type of patients, and even after bariatric surgery, which is a problem particularly with sleeve patients. Yeah. And then finally bariatric. A lot of stuff there. We did cover enhanced recovery specific to the bariatric patient. We had a lot of panels and expert opinion regarding procedural techniques, particularly for the sleeve gastrectomy. There's a lot of ways to do that operation, and the experts opined on their favorite approach. We had a session on the new guidelines.
Yeah.
These historic new guidelines on diabetes, and surgery now plays a prominent role, and these guidelines have been endorsed by all the world's major diabetes organizations. So we had a big discussion on how these guidelines will be adopted specifically by the payers, and how important it is to get the payers to change their coverage policies.
Yeah. That's exciting.
Yes.
So Phil, what's the secret sauce for thriving so much over 17 years?
We do have a secret sauce, and I'll tell you what our secret sauce is the faculty.
Yeah.
We have outstanding faculty who are not only experts, that actually are doing these types of procedures, but are great educators, and they're very generous with pearls of wisdom. And I really lean on the co-directors who really manage the various subcomponents of MIST.
You want to just tell us a little bit about next year's program?
Oh yeah, next year. Next year I think is going to be bigger and better than ever. It's going to be here again at the Encore in Las Vegas. We're going to bring back some of our top speakers. We're already putting together the program. You're going to see more on enhanced recovery. There was a lot of interest. I was surprised at the lines of doctors at the microphone waiting to address questions in that area. So we're definitely, and then of course it'll be filled with lots of controversial and cutting edge areas within bariatrics, hernia, colon, foregut.
Great. Put it on your calendar. And Phil, thanks for being with us today.
And don't forget, don't miss it.
Don't miss it.